Are you looking to boost your libido while improving your erectile function? Then let's discuss PT141. Hi, I'm Stephanie Wolf, the leading sexual wellness expert here in Studio City, California at the Novus Center. PT141 is a synthetic peptide that stimulates the central nervous system by activating the melanocortin receptors in the hypothalamus of the brain. Why that's important to you is because activating these receptors actually boosts the amount of dopamine you are releasing. As you know, dopamine is the neurotransmitter that's responsible for increasing your pleasure, your desire, and your sexual arousal. So it's no wonder if you're going to stimulate more dopamine, you're going to have a boost in your libido. Not only has PT141 been used to enhance the sexual desire, but it's also used for the treatment of erectile dysfunction. It does this by stimulating nitric oxide release from the brain. And as you guys know, nitric oxide is the most potent vasodilator that causes smooth muscle relaxation of the penis. And the more relaxation you have, the more blood flow you're allowing to fill up the penis, the firmer the erections. Now, I get the question all the time, can you actually take PT141 and Viagra together? And the answer is yes, but let me do a caution. Yes, they do work at two different mechanisms. Like I said, the PT141 stimulates the receptors in the brain, so it doesn't work on the cardiovascular system, whereas the Viagra, Cialis, Levitra, otherwise known as PDE5 inhibitors, actually works in the cardiovascular system by inhibiting calcium to come into the smooth muscle. Now, I did another video talking specifically about PDE5 inhibitors and how they work, but one thing I want you to remember is that calcium is a vasoconstrictor, meaning it's going to constrict the blood from flowing into the penis. So what these PDE5 inhibitors do is they make sure that the calcium is not allowed to flow into these smooth muscles, thereby allowing you enough time to get maximum blood flow to have these firm erections. So when you think about PT141 working on the brain, enhancing your dopamine release, also increasing your nitric oxide production, and then you have your Viagra, which is going to inhibit the release of calcium into this smooth muscle, you're looking for optimum libido and optimum sexual enhancement. But because both of them are causing this enhanced blood flow, you can have low blood pressure. So it's very important, if you do have high blood pressure and you're taking blood pressure medication, that you try one of these first before you add a second one to your regimen. And it's advisable that you seek some guidance from your healthcare practitioner before taking them together. So how is PT141 administered? Well, unlike the Viagras and the Levitras, it's not a pill. It's either going to be a subcutaneous injection, which means that you're using a small insulin needle, or what I like to say, a Botox needle. And you're going to be injecting this just underneath the skin. Most people will do it in their love handles or their stomach. And when you think about PT141, it takes about 45 minutes for you to see the effect. So a lot of times patients will do this injection about 45 to an hour before intercourse, quite similar to the way that you would dose the PDE5 inhibitors. Now, with the PT141, the half-life is only 2 to 3 hours, but it can stay in your system for 72 hours. So it's only recommended that you use PT141 3 times a week only. And again, that's just to make sure that you're not suffering from low blood pressure. Now, what are the side effects of PT141? Some of the most common side effects, as I said before, is low blood pressure, but you can also get headache and nausea, dizziness, flushing, very similar to the PDE5 inhibitors, but you can also get a site injection reaction, meaning redness, swelling, maybe pain or itching where the needle went into the skin. That's different than the PDE5 inhibitors. I must also mention that PT141 also is available intranasally. Most of my men prefer to do the subcutaneous injections, whereas my ladies prefer the intranasal spray. So you'll just have to try and see which one you prefer. The one thing that's different about PT141 versus the PDE5 inhibitors is that it can actually cause an increase in melanin or pigmentation of the skin. Remember, PT141 is actually activating your melanocortin receptors, and these are responsible for enhancing pigment, allowing you to get darker skin toned. So just be cautious about that. If you are going to be out in the sun and you are using PT141, you might notice that you're going to tan a little bit more than you usually do. So if you have any further questions, please give us a call at the Novus Center and let us help you decide which treatment is best for boosting your libido while enhancing your sexual performance.